Could your morning coffee hold a key to healthy aging, especially for women? This isn't just about a caffeine kick, it's about potential long-term health benefits backed by emerging research. Let's explore how your favorite beverage might influence your journey through the years. Coffee is more than just a drink. It's a complex mix of compounds. Scientists are actively studying its effects on various aspects of health. Recent findings are shedding light on its potential role in how we age. Specifically, researchers are looking at how coffee consumption might impact women as they get older. The focus is on maintaining health and function later in life. This research offers exciting possibilities for coffee lovers. A recent study presented at the Nutrition 2025 conference shared intriguing results. It suggested that regular coffee drinking could increase women's chances of aging without major chronic diseases or physical and mental limitations. This points towards coffee as a potential lifestyle ally. Coffee is already linked to a lower risk of certain conditions. These include liver problems and type 2 diabetes. Experts are keen to understand these benefits further and see how they apply to different populations, like women. For women, enjoying coffee might contribute positively to the aging process. The recent study results are particularly encouraging. They looked at the impact of both total caffeine and regular coffee intake. The findings indicated that higher intake was associated with a greater likelihood of experiencing healthy aging. This included having no physical function limitations, memory issues, mental health problems, cognitive decline, or major chronic diseases. The data came from participants in the well-known Nurses' Health Study. These specific results were shared at the Nutrition 2025 conference. This event took place from May 31st to June 3, 2025, in Orlando, Florida. The presentation highlighted coffee's potential role in supporting healthy aging outcomes. It's important to note that these findings were presented at a conference. They have not yet undergone the formal process of peer review and publication in a scientific journal. This is a standard step in validating research results. Healthy aging is a comprehensive concept. For the purpose of this particular study, researchers used specific criteria to define it. Participants were considered to have experienced healthy aging if they met several conditions. These conditions included living to at least 70 years old. They also had to be free from 11 major chronic diseases. Physical functional limitations were another exclusion criterion for healthy aging in this study. Being free of mental health or cognitive impairments was also required. Finally, participants needed to report having no memory complaints. Meeting all these criteria qualified a woman as having aged healthily according to the study's definition. The researchers utilized data from the extensive Nurses' Health Study. This is a large, long-term cohort study. It provided a rich source of data from a significant number of women over many years. The study included data from 47,513 women in total. This large sample size helps provide more robust statistical power to the findings. It allows researchers to identify potential associations with greater confidence. To assess caffeine consumption, researchers examined food frequency questionnaires. These questionnaires captured intake from various sources. These included regular and decaffeinated tea, cola, and regular and decaffeinated coffee. A baseline exposure level was determined for each participant. This was based on the average intake reported in the 1984 and 1986 food frequency questionnaires. This provided a starting point for tracking consumption over time. Caffeine consumption was analyzed in 80 milligram increments. This unit allowed researchers to quantify the dose-response relationship. They looked at coffee intake in standard 8-ounce cups per day. Cola consumption was measured in 12-ounce glasses per day. This standardized measurement helped in comparing intake levels across participants. It allowed for a clearer analysis of the different beverages. In their analysis, the researchers took steps to account for other factors. They adjusted for variables that could potentially influence aging outcomes. These adjustments help isolate the effect of coffee. Factors included participants' ages at the start of the study. Physical activity levels were also considered and adjusted for. Smoking habits, a known factor impacting health, were accounted for. Alcohol intake was another lifestyle factor included in the adjustments. By controlling for these variables, researchers aimed to reduce the influence of confounding factors. This strengthens the likelihood that observed associations are related to coffee. The study followed participants for an impressive 30 years. researchers reviewed questionnaires from 2014 and 2016 to assess aging outcomes. This long follow-up period provides valuable insights into long-term effects. By 2016, just over 3,700 women in the cohort met the study's criteria for healthy aging. This group represented the successful aging population within the study. Their characteristics were compared to those who did not meet the criteria. The majority of caffeine intake among participants came from coffee. This highlights coffee's prominence as a caffeine source in this population. The median daily caffeine consumption at baseline was 315 milligrams. Total caffeine intake was associated with increased chances of experiencing healthy aging. This association extended to the subdomains of healthy aging as well. This suggests a broad positive link. When looking at specific sources, regular coffee intake was linked to increased chances of healthy aging. This finding points specifically to caffeinated coffee as potentially beneficial. It distinguishes it from other beverages. Interestingly, researchers did not find a similar association with tea or decaffeinated coffee. Decaffeinated tea also showed no link to healthy aging outcomes. This suggests the benefit might be tied to caffeinated coffee specifically. The results also indicated a potentially negative association with cola consumption. Drinking cola might actually decrease women's likelihood of healthy aging. This highlights the importance of beverage choices. Study author Sarah Mahdavi shared insights into the findings. She is a postdoctoral fellow at Harvard T.H. Chan School of Public Health and an adjunct professor at the University of Toronto. Her perspective helps clarify the study's implications. Mahdavi highlighted the association between moderate caffeinated coffee intake in midlife and healthy aging later on. She emphasized the stringent definition of healthy aging used in the study. This definition went beyond mere survival. It required aging without major chronic disease, cognitive decline, physical disability, or poor mental health. Each additional cup of coffee was modestly linked to about a 2% higher chance of healthy aging. This suggests a dose-response effect, though small. In contrast, cola intake was associated with a significant 20% lower chance of healthy aging. This stark difference underscores the potential impact of sugary drinks. The association with coffee was not seen with decaf or tea. Mahdavi suggested this might be due to lower intake of those beverages. Differences in bioactive content could also play a role. Coffee contains numerous compounds beyond caffeine that might contribute to health benefits. While these study results are promising for coffee enthusiasts, it's important to interpret them cautiously. Drawing definitive, strong conclusions based solely on these findings may be premature at this stage. Further research is needed to confirm and expand upon them. One limitation is that the study data included only women. The majority of participants were also white. It would be valuable to see if similar results are found in other demographic groups and populations. Replicating these findings in diverse populations is crucial. It would help determine if the association between coffee and healthy aging is universal. Future research could also explore different age ranges and various healthy aging outcomes. The study relied in part on participants self-reporting their health information. This method can sometimes introduce errors or inaccuracies. Recall bias is a potential factor in studies using questionnaires over long periods. It's also possible that researchers did not account for every potential confounding factor. Other lifestyle or environmental elements could influence both coffee consumption and aging outcomes. Identifying and controlling for all such factors is challenging. Additional details about the study methodology are not fully clear at this time. For instance, the impact of coffee additives like sugar and creamer is not explicitly detailed in the conference abstract. These additives could influence health outcomes. It's also unclear if the analysis accounted for changes in caffeine intake over the 30-year follow-up. Focusing solely on baseline consumption might not capture the full picture of lifetime exposure. Longitudinal changes in habits are important. Bruce G. Rankin, DO CPI FACOFP, president of the Florida Osteopathic Medical Association, commented on the findings. He was not involved in this specific study. His perspective adds valuable context from a clinical standpoint. Dr. Rankin suggested that meta-analysis studies could further support the theory. Combining results from multiple studies strengthens evidence. If reproducible, the findings would strongly suggest a clinical health benefit from moderate caffeinated coffee for women over time. He noted that moderate caffeinated coffee is generally considered safe for most people. However, he also highlighted that certain health conditions require careful monitoring of caffeine intake. Hypertension is one example where excessive caffeine can be problematic. Dr. Rankin's comments underscore the need for personalized health considerations. What is beneficial for one person might not be ideal for another. Consulting a healthcare provider is always recommended, especially with existing conditions. Overall, the study results suggest a potential long-term benefit for women who drink coffee moderately in midlife. It aligns with the idea that certain dietary choices can influence aging. The findings also serve as a cautionary tale regarding sugary sodas. Sherry Ross, MD, a board-certified OB/GYN and women's health expert, also weighed in. She was not involved in the study. Dr. Ross sees the clinical implications as supportive of moderate caffeinated coffee consumption for healthy aging. She highlighted coffee's antioxidants and other bioactive compounds. These components are thought to contribute to its health effects. Dr. Ross suggested that adding moderate caffeinated coffee to a list of healthy lifestyle choices should be encouraged. She also emphasized the study's finding on sugary soft drinks. Reducing or eliminating these beverages should be encouraged for healthy aging. The non-alcoholic drinks you choose are an important part of a lifestyle aimed at longevity and health. However, despite the potential benefits, caution is warranted. Coffee is not universally beneficial for everyone. Individuals taking medication for chronic conditions should consult their doctor. Caffeine can interact with certain medications. It can also impact underlying health conditions. A healthcare provider can offer personalized advice based on your specific health profile. Madhavi also offered a crucial caveat. She stated that coffee is not universally beneficial. Caffeine metabolism varies significantly among individuals. Genetic factors play a role in how quickly caffeine is processed. Hormonal factors like estrogen can also slow caffeine clearance. This means some individuals may metabolize caffeine differently. Madhavi referenced prior research showing that women with slower caffeine metabolism might not benefit from high intakes. They could potentially be more susceptible to adverse effects. This highlights the concept of personalized nutrition. Taking into account both sex and genetic differences will be key in future dietary recommendations. This moves beyond one-size-fits-all advice towards more tailored guidance. Understanding your own body's response to caffeine is important. This research adds to the growing body of evidence on coffee's potential benefits. For health enthusiasts and coffee lovers, it's encouraging news. It suggests that your daily ritual might be supporting your long-term well-being. Remember, this study focused on moderate intake and specific outcomes in women. It's one piece of the puzzle in the complex picture of healthy aging. A holistic approach involving diet, exercise, sleep, and stress management is always best. If you enjoy coffee, continue to do so in moderation as part of a balanced lifestyle. Consider reducing or eliminating sugary drinks like cola. Pay attention to how coffee makes you feel personally. If you have underlying health conditions or take medications, talk to your doctor about your caffeine intake. They can provide guidance tailored to your individual needs. Stay informed about ongoing research in nutrition and health. Embrace healthy habits that support your body and mind as you age. Your lifestyle choices, including what you drink, play a significant role. Make informed decisions that contribute to your vitality and longevity.